Um, and we're on. Okay, hello everyone and welcome. My name is Arash Asher. For those of you that I have not met, I'm the director of the Cancer Rehabilitation and Survivorship Program here at Cedars Sinai Cancer, and I'm delighted to welcome everyone to One Bite at a Time. This is a series that was started some time ago, led by our own Megan Laszlo, to kind of give us bite-sized portions on little nutritional nuggets that relates to cancer survivorship and wellness. And she's done a variety of topics that's available on our YouTube channel. And today, the topic is examining dietary supplements for hair recovery after chemotherapy. I should start before handing over to Megan with a little bit of a disclaimer for conflict of interest. She probably did this for me because over the years you could see how much hair I've lost. So this is probably something she wanted me to have, which I very much appreciate. But in all seriousness, I know for many it can be a source of obvious distress when we're going through some of these changes. And at least when I'm in clinic, it's invariably one of the questions I'll get, which is, what foods can I eat? What supplements can I take that might help support hair growth? And it's kind of hard sorting through all the literature to sort out what is fact and what's fiction and what we know and what we don't know. Megan went through all the effort to distill through all that information. So I'm going to hand it over to her. Megan, thank you again for doing this. It's all yours.
Thank you, Dr. Asher. And I too get this question a lot, and I know our registered dietitians in the clinic get this question a lot as well. So I wanted to just talk about what's out there. So we'll go ahead and get started. I do ask you to put any questions that you may have in the chat, and we can get to those at the end of the presentation. We'll save time at the end, but we do have about half an hour budgeted for this talk. So make sure I can drive. Okay. And so this type of hair loss as it relates to chemotherapy is called chemotherapy-induced alopecia, and it's considered one of the most common adverse events caused by chemotherapy and can affect nearly 65% of patients. And this is due to damage to the hair follicles and can also include other hair loss as well, beard, eyelashes, eyebrows. And it is a very heavy subject to talk about. The negative effects can be very, very difficult to deal with. It can cause psychosocial quality of life issues and a great deal of distress. But the experience is highly individualized. So I want to point out that chemotherapy is not the only cancer treatment that can cause hair loss. These are the chemotherapies most associated with hair loss, but also immunotherapy and targeted drug therapy can cause this as well, whether it's from tyrosine kinase inhibitors like imatinib or erlotinib, VEGF inhibitors like Avastin. Endocrine therapy doesn't cause total hair loss, as does the immunotherapy or targeted drug therapy. It's more like excessive hair shedding. And so these endocrine therapy agents like aromatase inhibitors like Arimidex, Femara, Aromacin, or SERMs like tamoxifen, and somatostatin analogs like octreotide and lanreotide can also cause hair thinning. And sometimes this hair thinning can be increased when these drugs are combined with other targeted drug therapy. Radiation can also cause hair loss depending on the area that's being radiated. If you have someone that's being radiated to their salivary gland, you could have hair loss in that area of the face. And also PRRT can also cause hair shedding as well. And there's a lot of variability, especially with chemotherapy based on the regimen, the strength of the drug, and it may also cause other issues like a dry or itchy scalp, pain, numbness, or burning around the scalp. And there are also medications that can cause or worsen hair loss. This is just something to be aware of and discuss with your provider if you are taking medications that are further contributing to hair loss or hair shedding. Just to speak to the dietary supplements, it's really high dose vitamin A, potentially around 10,000 IUs or above. There's a lot of debate about the dose or amount of selenium that can cause hair loss, but we'll go into that in more detail. St. John's wort has been linked to a case of hair loss, and also high dose fish oil, because of its high vitamin A content, can also cause hair loss. And there are other causes of hair loss that can occur concurrently with cancer treatment. One is androgenetic alopecia, or male or female pattern baldness. And this is genetic, but can be influenced by diet and lifestyle, and can affect up to 80% of men and 50% of women. And then there are other causes as well that can be cause hair loss due to disruption to the hair development cycle or damage to the hair follicles. These can be acute or chronic. So if experiencing experiencing hair loss outside of cancer treatment, it's important to discuss it with your doctor to really just determine the underlying cause and not always assume that it's diet related. And all these different variables can certainly happen concurrently with cancer treatment as well. When you look at things like nutrient deficiencies, like protein deficiency, biotin, iron, or zinc deficiency can contribute to hair loss. Stress is probably one of the number one contributors. Drug use, medication use, changes to the immune system, endocrine disorders like hypothyroidism, PCOS, hormonal changes. If you think about perimenopause, menopause, or even the postpartum period can cause hair loss. Genetic and epigenetic changes from environmental factors, and also just rapid weight loss, which we're hearing more about the hair loss that can occur with some of these GLP-1 antagonists like Wegovy. And so thinking about hair regrowth after cancer treatment, it usually kind of starts out as peach fuzz if it's been totally lost during treatment, around 6 weeks after chemotherapy ends. Really starts to grow 3 to 6 months after that. And the hair may initially grow back a different color or texture, and it may take several months to even a year for the hair to return to its prior texture and color. Some individuals may experience no hair regrowth or only partial hair regrowth. Sometimes this is referred to as permanent or persistent chemotherapy-induced alopecia, and it's usually diagnosed at the 6-month mark after chemotherapy, and is most associated with Taxotere chemo. In terms of prevention strategies, there's a main one. It's FDA approved, and it's scalp cooling. This was approved by the FDA in 2015. It works through a process of vasoconstriction, so it reduces blood flow to the scalp and reduces the amount of chemotherapy that gets into the hair follicle. There is higher efficacy with the taxane-based chemotherapies like Taxol and Taxotere versus the anthracycline-based chemotherapies like adriamycin. And you can't do scalp cooling with all chemotherapy types. Some agents like oxaliplatin can cause a cold sensitivity neuropathy, so you can't use cold caps with that. And those with hematological tumors that are a high risk for scalp metastases can't do this as well. And it's cost prohibitive, it's uncomfortable, and the success rate is about 50 to 70%. And then in terms of treatment, I really want to focus on what's been studied specifically for chemotherapy-induced alopecia, and not all interventions for all different types of hair loss. So we just want to focus on that for this section of the presentation. And so minoxidil, one of the brands, there are multiple brands now, but the prior brand was just Rogaine. This is a topical over-the-counter agent. It's been FDA approved for male or female pattern baldness, and it seems to be most effective in the early stages, but still has a benefit in later stages. Some individuals, when they try this, they may experience just initial hair shedding, but that goes away. And then if it's helpful in promoting hair regrowth, it's an agent that you have to keep using. If you stop treatment, the hair loss will resume. This is if you're using it specifically for male or female pattern baldness. But it has shown some efficacy with chemotherapy induced alopecia. So one double-blind randomized control trial found that women that use minoxidil 2% twice per day, so applied to the scalp twice per day for 4 months after chemotherapy, had faster hair regrowth compared to those that did not. So it kind of sped up the process of hair regrowth by 50 days. And another trial showed that it was effective at promoting hair regrowth after taxane-based chemotherapy, even for those that were considered to have permanent chemotherapy-associated alopecia. So this could be a treatment modality for that. And it's also been tested in combination with other therapies like vitamin A, zinc, and Korean red ginseng, but the results were not superior to just using minoxidil by itself. Some off-label treatments. One is oral minoxidil. This is a low-dose prescription-based treatment. It's found to be an effective alternative to the topical treatment that you have to apply to your scalp either once or twice per day, depending on the concentration. This is something definitely to discuss with your physician, your medical oncologist, your dermatologist, and kind of discuss whether or not a multi-treatment approach may be beneficial. Another one is aldactone. This is known for usually used for individuals having fluid retention, but it reduces the production of androgens, including testosterone, and it's usually prescribed when other treatments like minoxidil don't work. This is an oral medication, has various side effects. But it's also been been studied in permanent chemotherapy-induced alopecia, and it did show moderate to significant improvement when combined with minoxidil. And it's considered safe to use in breast cancer. And then another option is this prostaglandin F2 alpha analog. This is a topical gel that's been shown to significantly improve eyelash length, thickness, and darkness after chemotherapy. So that could be an agent that could speed up that process too. So now really to the meat of this presentation, the complementary and alternative medicine that we get asked about so much. I want to highlight that I didn't see any studies that looked at these different agents and different vitamins, minerals, herbs, specifically for chemotherapy-induced alopecia. So that said, let's take a look and see what the evidence is. The most common one we hear about, the poster child, is probably biotin. It's produced by gut bacteria and obtained from the diet. There's an adequate intake level, even though our bodies make this, we still should get some from the diet, and it can be found in a wide variety of foods. Most notably, eggs have about 25 micrograms, or almost a daily amount of biotin in them. And deficiency for biotin is pretty rare. It's usually found for those that are consuming raw egg whites that contain avidin, which bind to biotin, preventing absorption. Those with malabsorptive issues like IBD, short bowel syndrome, and others that may cause a deficiency. Alcoholism, pregnancy, prolonged use of antibiotics because we're relying on our gut bacteria to make this, and medications that are used as anti-seizure treatment. But there's really no evidence that biotin improves the growth or texture of hair in people that are not deficient. Even though we see biotin in every marketed hair and nail supplement out there, there's really no evidence to support their use unless someone does have a true biotin deficiency. So that's worth taking into consideration, as well as these risk factors for biotin deficiency, because serum levels of biotin are not a reliable marker to assess for biotin deficiency. It's really a urine test, so that could be something to also just discuss with your provider. And biotin interferes with labs, a lot of labs, particularly hormone labs like our thyroid, testosterone, and interestingly, cancer antigens as well. And this is really important to pay attention to because these values can play a role in treatment decisions, and taking supplemental biotin can interfere with them. And the interference really depends on the test itself. Some of the tests are being reformulated due to this interaction, but the results could be falsely high or falsely low, depending on the particular test itself. And for some of them, there's interference at 5 micrograms of biotin, and at others, it's more like 10,000 micrograms of biotin. So it really also just depends on the amount that's being taken. You can see it also interferes with these other hormone tests. viral infection tests, and even some nutrient lab values like ferritin, vitamin B12, and vitamin D. This is not an exhaustive list of everything it interferes with. If you want more information about that, you can go to ARUP Laboratories. They have a really great reference for when biotin interferes. But the takeaway is if you are taking a supplement that has biotin in it, you want to avoid it for 3 days prior to laboratory testing. If you're just getting a complete blood count and a complete metabolic panel, it's unlikely to interfere with those, but any of these other tests, certainly stop taking biotin for 3 days prior. Getting biotin from the diet or eating eggs is not considered a concern. And with that, I want to look at a few different other agents that are used for hair regrowth. One is rosemary oil, topical, applied to the scalp. So I found one randomized control trial comparing rosemary oil versus minoxidil 2%. This was studied for androgenetic alopecia. And there was a 6 month trial in men in Iran, age 18 to 49, and they applied either 1 milliliter of the rosemary lotion, which they kind of used essential oil with the carrier, or minoxidil twice a day. And 1 milliliter is like a fourth of a teaspoon of oil or minoxidil. Both groups had significant increase in their hair counts, and both products did increase scalp itching, which minoxidil is kind of known to do that, but it was more frequent in the minoxidil group. So it sounds like the rosemary oil was better tolerated. And it's hypothesized that rosemary oil increases hair follicle blood supply, so maybe a vasodilator may work similar to minoxidil and shouldn't be used during chemotherapy, just like minoxidil should not be used during chemotherapy because you could increase the amount of chemotherapy getting to the hair follicle, which could further damage the hair follicle. But this may be an alternative if you want a topical agent and the minoxidil isn't working for you or that it's too sticky or you're having other issues with it. Pumpkin seed oil is another topical agent that's been studied compared to minoxidil. So another randomized control trial compared the pumpkin seed oil to topical minoxidil 5%. And this was done in women. It was a 3 month trial. And again, they applied either 1 milliliter of the pumpkin seed oil once daily, or if they're using 5%, so they did the minoxidil once daily. And there's a significant improvement in both groups, but the minoxidil seemed to work better than the pumpkin seed oil. And to date, no studies have really assessed the safety of pumpkin seed oil in patients with breast cancer. We don't really understand its impact on hormones. One of the theories why this may work is that the phytosterols in the pumpkin seed oil inhibit the conversion of testosterone to dihydroxytestosterone. And so that may play a role in androgenetic alopecia. And then another supplement I wanted to take a look at quickly is selenium. There's a recommended daily intake of 55 micrograms, just for reference. And this is found in a lot of different supplements that are used for hair regrowth. So I just wanted to highlight this. Some studies have shown that and we see this with other antioxidant supplements as well, that taking selenium is associated with greater risk of death when compared to a placebo, or that it's associated with mortality. A really big trial that I wanted to highlight is the SELECT trial. This was done back in 2014, and they were looking at selenium and vitamin E to see if it would prevent prostate cancer. And so they found that 200 micrograms of selenium per day actually increased the risk of cancer by 91%, and those with high selenium status, so meaning that their blood levels of selenium were high to begin with. And so this was really concerning. They also found that taking supplemental vitamin E increased risk of cancer in those with low selenium status. So there was a lot to be understood from this study. Later, a review was done in 2018 showing that taking 200 to 500 micrograms of selenium per day had little or no effect on cancer incidence or mortality. So there's some conflicting information based in the research. I think this is important to pay attention to, and I just want to briefly highlight our American Institute for Cancer Research recommendations, which are to not use supplements for cancer prevention. And I would say that this is especially true with our antioxidant supplements. They're not inert. There's this idea about dietary supplements that If we don't need them, that will just urinate them out, or we'll just have really expensive urine and they don't harm us. But I think there's a lot we still don't understand about isolated dietary supplements and really should be careful with them. And one of the reasons behind this recommendation not to use supplements for cancer prevention is the SELECT trial. So I wanted to highlight this comprehensive review of nutritional supplements for hair loss in breast cancer patients. And so they were really looking at what is considered safe, hazardous, debated, or requires caution. And so you can see this outlined here. I'm not going to go over each and every single one of them, but vitamin D was considered safe at diagnosis, during treatment, during endocrine therapy, and during post-treatment follow-up. You can see there's some concern about the trichotrenols, so we'll just call this vitamin E. So during chemotherapy, it's an antioxidant supplement. There's also concern about taking vitamin B12, and for individuals that don't have a deficiency. Hi there, you can come have a seat.
Here.
Sure. Yeah.
Am I the only one that showed up?
So we're actually being recorded. There's a no, it's okay. We're on a Zoom meeting as well. But help yourself. So with vitamin B12, there's a theoretical concern that the high dose of B12 could promote cellular proliferation, meaning it could drive cancer cell proliferation, and it should be limited unless you have a confirmed deficiency. Also, some concern about taking iron supplements during cancer treatment. There's some concern that iron could contribute to tumor progression through involvement in the tumor microenvironment. So there's some hesitation here about these particular supplements. And then going down the list, looking at caution with the biotin, that's specifically because it interferes with lab values, as well as concern about saw palmetto as well, because saw palmetto may increase the estrogen levels in the body. So there's some concern with taking that supplement, and they advised against individuals using it for estrogen sensitive cancers, and then also phytoestrogens. So these are from dietary supplements, and I want to note that soy isoflavones have been demonstrated to reduce risk of breast cancer. They seem to bind to estrogen receptor beta rather than alpha, and seems to be safe to use, but there are also other types of phytoestrogens, so that's something to just be aware of and use caution with. Just wanted to highlight this. Another component that's used in combination supplements is often collagen. We've had to talk about collagen in the past. And generally oral supplements pose minimal health risk. It's generally well tolerated, but it's really, has not been found to promote hair growth. And there's a lot of claims that you'll see about it, that it causes hair to grow faster, increases volume, but those are really unsubstantiated, and it hasn't been studied with chemotherapy-associated alopecia. I want to take a look at a couple different combination supplements and just highlight them for you here. So one is Viviscal. It's a hair growth supplement. It's pretty popular. I just wanted to highlight a few things about it. One, the niacin source. This is niacinamide. This will not cause flushing. Two, it's pretty high in biotin, 400%. And this is a useful thing to look at when observing nutrition labels. It's to see what's the percent daily value. Is it 100%? Is it 5,000%? Is it considered high dose or not? I have some concerns about, taking this long term just because it is high in zinc. Does that really serve us? I was thinking about that and how some of these bivalent minerals may compete for absorption, may cause deficiencies. And then also it's got this marine collagen in it. We don't really know that that works. The horsetail extract and millet seed extract really haven't been studied alone for hair regrowth. They always seem to be combined with other things, and we don't really know much about them. So those are my hesitations with this particular product. There's really limited research on it. The formulations of Viviscal have changed over time from study to study, so that's one critique with this product. And also Some of the placebo-controlled studies have shown a hair growth benefit for those with perceived hair thinning and male pattern baldness. The studies generally lasted 3 to 6 months. It's worth noting there was one report of liver injury for someone that was using it for a year. And just another critique of the studies, they're not really comparing this to like a multivitamin to see if a multivitamin is also effective, or comparing it to something like minoxidil, which we know to be effective. So I wouldn't recommend it, but I think out of all the products that we're going to look at, this one has the least amount of concerns. This is another one that's pretty common. It's called Hair Levy. This one, the niacin, the nicotinic acid, can actually cause flushing of the skin. So that's something to be aware of, that this form can cause like all over skin flushing. And then again, looking at these percentages, it's extremely high biotin, definitely going to interfere with hormone labs and cancer tumor markers that we reviewed earlier. And, just some other concerns with it as well. This really high amount of selenium, we don't know what amount of selenium actually causes hair loss. Some studies, like the SELECT trial, they actually did a side study and showed that there was hair loss with 200 micrograms of selenium. So that's something to be aware of too. This, supposed hair growth supplement has something in it that may cause hair loss, and that amounts that have been shown to cause hair loss. It also has beta carotene in it, which I take issue with because, one, it's high, it's over 100%. And two, there are studies that show that beta carotene supplementation can increase risk of lung cancer in people that were former smokers. So again, these supplements, they're not inert. There have been negative effects associated with them. It also has saw palmetto in it. Another one, Nutrafol, this is our last one we'll go to in detail, has very, very high amounts of beta carotene as well, very high in biotin. Iodine, don't even know why that's in it. We get plenty of iodine in our diet in this country. And then yes, very high selenium as well. So some of the same concerns. Also has saw palmetto. I wouldn't necessarily recommend, this supplement either. And this, Nutrafol has a whole product line. And they've had a lot of issues. They've had some FTC complaints due to the lack of research to back up their product claims. Within the research, there have been some modest benefits for hair regrowth, but really poorly designed studies that were funded by or conducted by employees of the company. So those are something to be aware of. There's also a case of liver injury in a woman that took this product for 5 months that was directly linked to the product. And then another case of chronic kidney disease that wasn't clear if it was related to the product. These are other supplement formulas that have been used for hair growth, but there's numerous issues with them: small studies, lack of a placebo control, they're either manufacturer funded, or the studies aren't specifically done with chemotherapy. And none of these studies were done with chemotherapy associated alopecia. So I want to just draw a few conclusions from this before we get to the Q&A. One is, minoxidil appears to be the most effective agent to promote hair regrowth after chemotherapy. But this is something that you do want to discuss with your doctor, when to use it, like how long after chemotherapy ends to use it. You don't want to use it during chemotherapy, and just discuss other treatment options as well. It's worth noting that the minoxidil that's marketed to men is less expensive than the same minoxidil that's marketed to women. It's okay for women to use the men's product. The 2% solution is used twice a day. The 5% is once per day. And, in terms of nutrition strategies, I think there's a benefit to eating an adequate amount of protein and nutrient-dense foods, being conscious of making sure that every meal that you have, every snack has a source of protein in it, unless you have a reason to restrict, and to really focus on eating a high quality diet so that you do have adequate amounts of biotin and iron and zinc, and can work with the dietitian to strategize which foods to consume. Oops. And then, these dietary supplements seem to really lack studies to support their use for hair regrowth after chemotherapy. And worth noting, as always, that dietary supplements are very poorly regulated by the Food and Drug Administration. They have very little oversight in terms of their purity, whether or not they have in it what they say they have in it. And that's why we rely on organizations like Consumer Lab Reports to act as a third party to evaluate them. Within their evaluation, though, they did not actually review any of those products to that level of detail to confirm their ingredients. So I think that's worth noting as well. And certain dietary supplements can have excessive selenium, vitamin A, that can actually cause hair loss. So that's something to pay attention to too. Before we get to our Q&A, I just want to highlight that all of these talks, our nutrition lecture series, One Bite at a Time, and our Wellness, Resilience, and Survivorship lecture series are included on Cedars Sinai Cancer YouTube channel. So that's worth taking a look at if you want access to any of our prior talks and recordings. We do have our next talk scheduled for October 9th. And Cedars Sinai is a nonprofit academic healthcare organization serving the diverse Los Angeles community and beyond. These vital programs are powered by the generosity of our compassionate donors, and we invite you to join us in transforming the treatment and survivorship journey for cancer patients. If you'd like to contribute to any of our wonderful programs, you may do so here or reach out to Laura. Her contact information is included there below. Thank you.
Okay, thank you so much, Megan. I know I have a couple questions. There are also some comments and questions in the chat, so maybe we'll go through them together. The first one that I see is asking about a supplement called, I think it's pronounced OMI. I looked it up briefly. Are you familiar with this one?
OMI? No.
But when I looked at it, it had something like the 10,000% required of biotin and it's similar to the other ones, a lot of the B vitamins. So I'm assuming your answer would be analogous to what you related with some of the other supplements you talked about.
Right, right. And it doesn't seem to be harmful to take biotin, but it also doesn't seem to be helpful. And there's that very real concern that it does interfere with lab values. So if you are taking something like that, to avoid it for 3 days prior to lab testing.
Okay, great point. The next point is an important one about the Brazil nuts in the image. I know there was like I think that was just for graphical demonstration. No one is suggesting that anyone should take, I'm going to speak on your behalf, but correct me, more than one or two at most per day of Brazil nuts. Is that agreed?
Yes,
Not nobody should take fistfuls of Brazil nuts. No one's suggesting that.
no, they're the poster child for selenium. I mean, they're the highest content selenium food, so that's why they were up there just as an example. Weren't suggesting to take large amounts of them and just acknowledging the concerns with excessive selenium.
Okay, so I'm glad somebody brought that question up, just so we're clear for all of us. Okay, another question. Which of the B vitamins are best and safest to take after cancer treatment?
I don't usually just recommend supplements for the sake of covering up dietary inadequacies or presumed inadequacies. And I think if you have a very logical reason to take one, you know that someone is at risk for niacin deficiency, for example, because of how their cancer is behaving in their body. And you're at that level of detail and can test for it. I think there's a reason there to take a supplement, but I would never blanket recommend B vitamin supplements. I think there's concerns with excessive B6 and actually causing neuropathy. I saw earlier there's some really a lack of understanding in the role of vitamin B12 and how it interplays with breast cancer. So there's concerns about them. I think it's really best to get your nutrients from your diet. Unless you are at risk for nutrient deficiency, let's say you're vegan, yes, then it makes sense to take a B12 supplement. But other than that, I really think it needs to be individualized.
And if I could just piggyback on that, Megan, to what you said, like excessive amounts of B6 indeed has been shown to be a cause of neuropathy in occasional situations. There was even, when I was in medical school, we were taught if you took a B12 supplement, you would just urinate the excess and there were no harms from that. pretty recently, there was a study, I think it was in the New England Journal of Medicine, that showed that some of the amyloid and tau proteins that are associated with certain types of dementia were associated with higher levels, excessively high levels of B12. So there might be issues on both extremes. If you're low in B12, it might cause cognitive issues. And there was a hint, I mean, they weren't really sure that there might be a concern if you check your level and you're over 2000. That's what our labs typically say, like this person's over 2000. So I would take caution on either front, as Megan is suggesting.
Right. And these nutrition related lab values require a great deal of interpretation, and vitamin B12 levels can be elevated for other reasons too. So I think we can't always rely on the level itself. We have to consider, is there inflammation? Is there liver disease? What other factors can be influencing these markers? Because they're not straightforward.
Okay, great. Thank you, Megan. Somebody else asked about vitamin D for osteoporosis, which I could tell you might be a whole talk in and of itself. Maybe we'll revisit that. If you have a brief comment, and can you talk a little bit more about carotene as a relationship to lung cancer?
About beta carotene, I didn't cite this study for this talk specifically, but there was a study looking at, whether taking beta carotene could help prevent lung cancer. And in this study, they found that it was actually increasing the rates of lung cancers in individuals that were former smokers. So the idea was saying, if, taking beta carotene supplement could help prevent it, in fact, it increased risk. And so that's, one of these reasons why the American Institute for Cancer Research is advising against taking dietary supplements specifically to prevent cancer, because a lot of the studies that looked at that showed that it actually increased risk of cancer, like the SELECT trial and like this beta carotene study as well.
And just to clarify, I think part of the question, this is when it was taken as a supplement, not when it was obtained from broccoli and carrots and whatnot.
Correct. Yes, taking an isolated dietary supplement. There haven't been concerns about selenium or vitamin E from the diet and increasing risk of prostate cancer, or concerns about beta carotene or vitamin A from the diet, increasing risk of lung cancer.
Great, thank you.
The
Somebody else.
food seems to be always safe.
Food always seems to be the safest source. Thank you. Except for taking fistfuls of Brazil nuts, maybe. I've used, somebody else wrote, I've used minoxidil for years, including during chemotherapy, 2 times a day, I believe. Where exactly is recommended? I guess where should it be applied, I think is the question.
That's a good question. And this also comes up too, for me, especially when researching the rosemary oil, because I've seen like Instagram videos and social media where putting rosemary oil like throughout the hair as a hair oil. But the minoxidil and the rosemary oil and even the pumpkin seed oil were meant to be applied directly to the scalp. And there was an image I included earlier of a scalp massager that could be used to do that, especially for someone with long hair, to be able to get it directly on the scalp. And that, brings up, how it's being applied, but also just being aware that that's where it needs to go. And if you are using something like an oil that might make your hair more oily, you might have to wash your hair more often, and just kind of weighing how that would interplay with your hair health as well.
Thank you. A couple more. Somebody asked, have you seen hair loss after the hair has regrown? I'm thinking for myself as well. I mean, I think that would be one of those situations where I'd really want to go through with my provider, like medical factors that might be playing a role. Megan, other thoughts?
Yeah, I mean, I think it's definitely worth the conversation with your provider. I read something where it said that was acknowledging that many individuals were on average waiting 4 years of hair loss before 4 years of hair loss before they actually brought it up with their provider. So I do, and by that point, the interventions may not be as effective. So I think it is worth bringing up earlier and determining, is it nutrient deficiency related? Is it stress related? Is it medication related? What is it specifically? And then going back to, this treatment with minoxidil, it only, for male or female pattern baldness, it only works as long as you're actually still taking it. If you stop taking it, can expect the hair loss to resume.
That was actually one of my questions about the rosemary oil. Would that have an analogous process, but where if you stop using it, you're going to lose the hair, or not sure?
I mean, that seems to be the thinking. It seems to work in a similar way to the minoxidil. So you would assume that, but those studies really haven't been done. I only found one one randomized control trial on the rosemary oil.
Okay. For somebody that is a vegan or vegetarian, what foods can override B12 deficiency?
Well, if it depends on what you eat, right? So if you're a vegetarian that eats eggs, that contains vitamin B12. And in fact, just take this moment to point out that I brought some deviled eggs to share for anyone joining in person because they are a good source of so many different nutrients. They contain biotin, they contain B12, they have some iron, they have a little zinc in them. They're very nutrient diverse, but um, yeast is another source of vitamin B12, nutritional yeast, and that's often used by vegans as a way to get B12 in the diet. But other than that, it's mostly supplements.
I'll just share, I just came back from Australia and I learned that Vegemite apparently has loads of B12 if you want to try Vegemite. Um,
An acquired taste.
it definitely an acquired taste. Yeah. Okay, I want to be sensitive to time. I think I just want to echo what Megan said in that we are up here in person, and again, Megan puts a lot of effort to creating a dish related to the topic of the day. So you're welcome to join us in person or virtually for the next one, which is October. Was it
Ninth.
October 9th? I want to thank you all so much for joining. I especially want to thank Megan for leading these sessions and being the mastermind behind it. I want to thank our dietarian experts in the background answering some of the questions, and as always, for Lachey for helping to orchestrate and organize all this. Any final comments, Megan? Last word is yours.
And I want to acknowledge all the work that you've done for this and putting this together and making sure this is happening. I really appreciate your support. I think we all appreciate being able to have the time to explore these topics. So thank you, Dr. Asher.
Okay, thank you all so much. Thank you, Megan. See you all next time, I hope.
Thank you very much.
Bye-bye.
Bye-bye.